Welcome back. We're here today with Ryan Barrett of Barrett Spinal Care. How are you, Ryan?
I'm doing great.
So glad
Thank
to
you.
have you here today.
Thank you.
You came here to Tahlequah in 2003 with your family, and you came here from where?
Parsons, Kansas. That's
Well,
where
we're
I was
so
born
glad.
and raised.
Well, we're so glad that you came here. Tell us a little bit about what you do for a living.
All right. Well, I guess first I should start by asking you a question. And the first question I have for you is, have you ever been working in the garden or outside and you get a rock in your shoe, a pebble in your shoe?
Oh, absolutely.
You have? Okay. And was it uncomfortable?
Yes.
All right. So what did you do for that?
Oh, I took the stone
Took it out.
That's right.
You didn't go inside and take some Tylenol or Loratab or Darvocet and keep the rock in there?
No, not unless
Okay.
I forgot to take the stone
Right. Right, because it becomes painful, right?
Exactly.
And what happens when the medication wears off?
It still comes back.
It comes back.
Right.
And you didn't go and have surgery for your
No.
foot. You didn't have your foot cut off, so you wouldn't feel it, right?
Right.
You went in there and you took it out. Well, essentially what I do every day is, rather than cover up or mask symptoms, we take away the cause of the problem so that people can have their health restored and their pain levels decreased. Okay?
Without medication.
Without drugs or medication, or surgery or medication.
That's
Absolutely.
wonderful.
Yeah. What happens is, when you have that pebble in there, you actually get an irritation to a nerve ending on your foot, which becomes painful. Well, 10% of our nerves actually control pain, and the other 90% control function, how your body works. So not only do we work with pain and removing, irritation on nerve endings of pain, but we also work on removing irritation on nerves of function, which really control how your body works, how you breathe, what your heart rate is, what your blood pressure is, your digestive system, a whole host of things. Okay, so it's important that you remove that cause of the problem.
Wow, that sounds really in depth. Do you do a lot of adjusting to the back, or how do you manage this?
Yeah, so what I specifically do is, a lot of people ask, well, why does your back even get out in the first place? Well, typically it's from accidents and injuries. Some form of trauma has happened, slips, falls. I mean, you fall learning how to roller skate or ride a bike, or slips on ice, or auto accidents, whatever. It doesn't have to be a major trauma where you're in the ER and ICU, but just those little bumps and falls along the way. And what happens is, those cause your spine and your soft tissue, like your muscles and ligaments, to break down. And so it breaks down and it locks into a stress position, okay? And so when your spine locks into that stress position, that's when the joints start to have pain. That's when the muscles tighten up and you get the muscle tension. And that's when, again, potentially you get that undetected nerve damage, okay? So how we go about correcting that is through a specific procedure called NUCA. And NUCA stands for National Upper Cervical Chiropractic Association.
I'm glad you said that.
Yeah, it's a mouthful. So NUCA is the name of the procedure, but more importantly, what it is a great way. It's very precise, it's very gentle way of correcting spinal imbalances, again, without the use of drugs or surgery, okay? So I am a chiropractor, and this is a specific technique within that field where we focus on using the top bone in the spine, which is called atlas, as a lever to gently move the other bones back into place. Okay, so a lot of times patients will come in for lower back pain, and I'll actually just work on the neck. And people wonder, well, how can the lower back get corrected or feel better when you just gently press on my neck? Well, again, the answer to that, the secret to that, if you will, is leverage. All right, you look at a pile of bricks at a construction site, and you think, there's no way I can lift all those bricks. It's 100 or 200 pounds, but you put them in a wheelbarrow, and you can easily move them, right? And it's leverage, okay? If there's a screw in the wall, you don't try to screw that in by hand. You get a screwdriver, and that gives you leverage. And the longer the screwdriver, the easier it is to move that screw. Does that make sense?
Oh, it makes perfect sense.
Okay.
I never looked at it that way.
So what we do is, there's actually a built-in tool called Atlas, and it's the top bone, again, in the spine. Your skull sits right above it. The rest of the spine sits right below it, and we use that top bone to gently move the rest of them back where they need to go. Okay, and in the process of that, one of the other really important things that I'd like to emphasize is your brainstem sits right in this area. So your brain communicates and actually controls everything in your body. We all know that. But if there's irritation through this brainstem area, it cannot properly communicate with the rest of the body. Okay, it's almost like you have a water hose and the valve on the wall, and then that hose is going to the garden. Well, you can get lots of different kinks in there, and typically what I say is, most chiropractors remove the kinks out of the hose, which is wonderful. They actually help water get to the garden. However, if the valve is turned down to 30%, it doesn't matter how unkinked it gets, it's still only getting a certain percentage. So we literally work on opening that valve up all day long for people. And so you get all the flow and new nourishment that you need to your body.
Oh, that makes perfect sense. I never looked at it in that analogy
Yes.
before.
Yep.
And I know that I have actually been your patient and gone in lifting grandkids and turning and twisting and just various activities can really take a toll on your body over a time. And if you're in a stressful business, as I am in, all of that in a combination can put you in a world of hurt.
Absolutely.
And coming to you, I was amazed that all you did was just lightly work on my neck. It was very quick and it was almost instantaneous relief.
Yeah. Yep.
Amazing.
It's wonderful. It's been a blessing to find this procedure in my life. It changed my life. I had a lot of asthma issues, and I actually started breathing better after my first adjustment. And my dad was ready for low back surgery, and a friend told him about this specific procedure and said, please try it before you have a back fusion surgery. And so he did out of a last-ditch effort, and it was after 20 years of chronic pain, it went away.
Wow,
Yeah.
that really did speak to you then, and
Absolutely.
it, I guess did change your life and so many others.
Yeah.
Well, you're one of only, the only one here in Tahlequah who does this procedure.
There's about 300 nationwide, and so Tulsa is actually the closest other than Tahlequah of someone that practices NUCA here.
Well, we're glad to tell the people of Tahlequah about this special treatment that you do perform, and we're glad to have you in Tahlequah.
Thank you very
So
much.
nice to have you on our program today, Ryan.
Thank you.
We'll be right back.